Hello, I am Toby Meyer, State Director of Decoding Dyslexia California. DDCA, in conjunction with our other webinar sponsors, CARS Plus and the California Association of School Psychologists, is pleased to present today's webinar on dyslexia and phonological processing with internationally recognized dyslexia expert, Dr. Richard Wagner. This webinar is intended to be technical in content. We will be hosting a similar webinar on dyslexia and phonological processing that is targeted for parents, guardians, and advocates in October. The link for the Eventbrite registration for this layperson webinar is listed on the slide. While this webinar on dyslexia and phonological processing has universal relevance, Californians are especially interested in this topic due to a new California Education Code effective January 1st, 2016, specifically adding phonological processing as an area to be assessed in determining special education eligibility. Before handing the presentation over, I wanted to spend a few minutes introducing Dr. Wagner. Dr. Wagner's accomplishments are so extensive that I have listed some of the additional highlights on the slide. Dr. Wagner leads the Florida Multidisciplinary Learning Disabilities Research Center. This center is one of only 4 centers in the United States funded by the National Institute of Child Health and Human Development. It represents NIH's flagship program for research on dyslexia and other learning disabilities. He is co-founder and associate director of Florida Center for Reading Research, and he is a research professor of psychology and Morecambe Chair at Florida State University. Dr. Wagner has provided his expertise in helping the states of Arkansas and California develop guidelines to implement statewide dyslexia legislation. Dr. Wagner has co-authored several tests that are commonly used in evaluating children for dyslexia and other learning disabilities, including the Comprehensive Test of Phonological Processing, or CTOP-2, which will be discussed in today's webinar. We will do our best to keep the webinar to 1 hour, but please don't miss the extremely valuable frequently asked questions that Dr. Wagner will cover at the end of this presentation. Now, I will turn the presentation over to Dr. Wagner. Welcome, Dr. Wagner.
Thank you very much, Toby. I really do appreciate the invitation to be able to do this today. By way of an overview of our webinar today, we're going to begin with a brief review of dyslexia. Some of this may be things you know, but maybe something will be new here. We'll talk about phonological processing and its relation to dyslexia, and then we'll move into how to use the CTOP-2 to assess phonological processing, talking some about some intricacies of administration and scoring, and then how to interpret the results. Finally, we'll end with the frequently asked questions that you just mentioned. So in terms of a brief review of dyslexia, if you were to watch an individual with dyslexia read, what might you observe? Well, there are 2 hallmark characteristics of the word level reading problem of someone with dyslexia. The first is an inability to sound out new words. New words require sounding them out, or maybe you can try to figure out what they are by analogy to some other known words. So that's the first area of weakness. The second area of weakness, which may result from the first area of weakness, is there ends up being a small pool of words that are read automatically. Typical readers recognize a large pool of words with little conscious effort. Then they can spend their conscious effort working out the comprehension. Readers with dyslexia, however, have to spend a lot of their conscious resources trying to sound out words. Let me give you a little example of what I'm talking about. What I'd like you to do is to look at, but don't read, the following word. Is everybody ready? Here it is. You can't do it. The speech motor system that would be used to pronounce horseradish was primed, and you might have even have pronounced it to yourself subvocally. You might have even visualized a jar of horseradish, and you maybe even had a subtle sensation in your nose just from your previous experience with it. And horseradish isn't even a common word. Let's try one more. Look at, but don't read, the following word. This is a very different experience. It's not a known word to you, and you most likely tried to sound it out. Individuals with dyslexia come across a lot more voluptuums than they do horseradish when they read. Another common characteristic of individuals with dyslexia is poor spelling and writing. And in fact, spelling and writing may even be more affected than reading is. I teach at the college level. It's not unusual to see college students who have had a history of reading problems, but their reading problems have been largely compensated because they've had very good intervention over the years, and they've also just read a lot. But what you see is they have a lot more trouble still with spelling and writing. Poor comprehension can be common, but it's really a byproduct of not being able to read the words on the page unless there's some kind of a co-occurring language problem that extends beyond phonological processing. We'll be talking about phonological processing later. Over time, however, there's limited information coming through the reading channel, and that can eventually affect comprehension. So it's really important to, for early identification, to get effective intervention as early as possible, and where needed, accommodations such as text-to-speech to get around the problem of limited information coming in through the reading channel. You don't want that to limit what a child knows about the world or their vocabulary or other aspects of their language development. In terms of some things about dyslexia that you may or may not know, but one is dyslexia is dimensional. There's a continuum that exists from having only a minor problem to a very severe problem. We commonly say that someone has or doesn't have dyslexia, the same way we say somebody has or doesn't have high blood pressure or diabetes. But there's a continuous dimension from very minor to very severe for high blood pressure, diabetes, and dyslexia. The only symptom of a very minor problem might be that spelling is a little bit more of a challenge than you would expect it to be. But the more severe the reading problem, the longer it lasts, the more resistant it is to remediation, and the more important accommodations become. One of the major breakthroughs about dyslexia was the discovery that dyslexia is due to a problem in language, not in vision. The language system that's implicated is the phonological system. It's used for it's used for processing speech sounds. Now, you might think there are visual problems as well, because if you look at a child with dyslexia when they read, you'll see lots of stops and starts and backward movements. Turns out if you look at yourself while you read in a mirror and you look very close at your eyes are doing the same thing. But it is true that the eye movements of children with dyslexia look choppier than typical readers do. But that turns out to be a byproduct of not being able to read the words on the page, not the cause of it. You should be skeptical about visual treatments for dyslexia. The pursuit eye movements that sorry, the lights went off. Man. The lights are back on, so we'll just keep going. And so basically I said you should be skeptical of visual therapy treatments for dyslexia. The pursuit eye movements that you can train when your eyes are following my finger, for example, they're not the involuntary eye movements that you need to be able to do when you're reading. Dyslexia does run in families. A family history of reading problems is associated with a 4 times greater risk of dyslexia. But note that even if you have a parent with dyslexia, the chances that a child will have dyslexia are still much less than the chances that they won't have. So it isn't destiny that mothers and fathers with dyslexia will have children with dyslexia. Dyslexia occurs in both males and females, but males are about twice as likely to have the severe problems that I was telling you about before than are females. The other thing that is true is that dyslexia rarely occurs alone. Co-occurring conditions are the rule rather than the exception. Common ones include ADHD, dysgraphia, having problems manipulating pencils and pens, dyscalculia, having trouble with math and calculations, poor spelling and writing that I mentioned, and a history of early speech or language problems. So having done just a brief review of some characteristics of dyslexia, now let's turn to phonological processing and its relation to dyslexia. Phonological processing refers to the use of speech sounds for coding information when reading, listening, and speaking. There is a little footnote here to a reference that's in the back of the webinar. This was a paper that I wrote with Joe Torgerson, and it really was the first paper to use phonological processing in this reading context. Phonological comes from the Greek word phone, which means sound or voice. You don't want to confuse this with a similar sounding term from the speech field, where a phonological processing disorder means a pattern of pronunciation errors when speaking. We didn't actually know about this other use of the term phonological processing when we appropriated it for our article for these reading-related problems. But there's been kind of a happy resolution, because I actually Googled phonological processing this morning. And if you do that, you actually see the definition that Joe Torgerson and I came up with, rather than the specific one about the speech problem. But ASHA is the website where it shows up. So it looks like it's all come out. So there are three kinds of reading-related phonological processing that we want to be talking about today. The first is phonological awareness. The second is phonological memory, and the third is rapid naming. Phonological awareness refers to awareness of and access to the sound structure or phonology of one's language. To give you an example of this, I want you to think about something for a minute. How are the spoken words cap, map, and tap the same, and how are they different in the sounds they contain? If you have okay phonological awareness, you're going to realize they have identical middle and ending sounds. They have the a sound in the middle, they have the p sound at the end, but they have different beginning sounds. If you can hear how they are the same and how they're different, their spellings make sense. They have different first letters, but they have the same middle and final letters. If you can't hear how they're the same and how they're different, the spellings seem arbitrary. All you can do is try to memorize lots of spellings. It's a much harder way to try to learn to read. We know a lot about the development of phonological awareness. Children's ability to do phonological awareness tasks begins with an ability to do the task with very large units, and then gradually over time with development, they can move to smaller units. So the largest units are word length units. So you can ask a preschool child to say cowboy, now say cowboy without saying boy. And unless they have a phonological awareness problem, they can say cow. They can do phonological awareness tasks on compound word length units. The next smaller unit is syllables within words. So you can maybe pull apart 7 from the word 7. Then you can differentiate onsets and rhymes. Onset is the sound prior to a vowel in a syllable, and rhyme is the vowel and remaining consonants within a syllable. So for the syllable that happens to be a word pen, p would be the onset and n would be the rhyme. Later with development, you can pull out phonemes within rhymes. So you can hear the n in n. And finally, at the highest level of phonological awareness, you can be able to differentiate phonemes within consonant clusters, like which is a pretty difficult thing to do. We know that phonological awareness plays a causal role in learning to read, probably, at least for alphabetic languages, probably for the reason I mentioned. If you can hear the similarities and differences among CAP, MAP, and TAP, their spellings are sensible, learning to read is an easier thing to do. Impaired phonological awareness is one of the most common characteristics of individuals with dyslexia, and that probably explains one of the reasons why it's so hard to learn to read, and also explains why they have trouble sounding out words. Phonological awareness can be taught and trained. Training phonological awareness early can prevent or at least mitigate the severity of later word reading problems. But early identification is really critical to prevention. Reliable identification of children with poor phonological processing can be done now as early as age 4. Although most children respond to phonological awareness instruction, children with severe phonological processing problems do not respond to instruction as well as their peers, and sometimes even not really much at all. So that's phonological awareness, the first of 3 kinds of reading-related phonological processes. The second is phonological memory. Phonological memory refers to coding information phonological for temporary storage in short-term memory. You'll use your phonological memory if you try to remember maybe a phone number or someone's name you just heard maybe at a party, for example. You do the same for sounds that make up the pronunciations of words you read as well. The phonological memory has 2 parts that make up something called the phonological loop. And the phonological loop is really important for your phonological memory. The first is a phonological store. It's like a tape recording loop that retains the most recent 2 seconds of auditory information that has been recorded. The second is an articulatory control process. It provides input to and can refresh the contents of the phonological store, extending the time that information can be held. Impaired phonological memory makes it difficult to sound out new words and to read complex sentences. Probably doesn't affect the ability to read short, familiar words all that much. Phonological memory can be useful for very early identification of children with phonological problems. Preschool age children can't do phonological awareness tests that require access to phonemes. As we mentioned, they can do phonological awareness tasks with larger units. So you can ask a child to say starfish, now say starfish without star, and many of them will say fish. But it still is a little bit of a cognitively complex task, especially for young at-risk children. Here's an example of a little scenario we had when we gave one of our tasks to children. So the examiner said, say doorbell. Child said doorbell. Examiner says, now say doorbell without bell. Child says doorbell without bell. It's exactly what we asked the child to say, but they didn't clearly understand the task and what they wanted, what we wanted them to do. Phonological memory tasks, in contrast, are cognitively simple. It typically just involves repeating what you hear. Non-word repetition, which is a phonological memory task, has been used in children as young as age 2 when you give non-word names to puppets, which makes it easier for the child to do the task. There's an important overlap between phonological awareness and phonological memory for pre-readers. Before you learn to read, phonological awareness tasks and phonological memory tasks actually appear to tap the same underlying phonological ability. Most likely, it's the quality of one's phonological representations. This means that phonological memory tasks can be helpful for finding phonological processing problems in very young children who perform poorly on phonological awareness tasks, and you're not quite sure whether they're understanding, what the task really is asking them to do. So it's a nice thing to be able to give them a phonological memory task as well. The third kind of phonological processing that's important in learning to read is rapid naming. Rapid naming of digits, letters, objects, or colors requires retrieving phonological information, the pronunciations of their names, from permanent memory. This retrieval process is used when retrieving pronunciations of words or parts of words when you read them. For rapid naming, it matters a lot what you're asked to name rapidly. One primary distinction that's made, symbols that are used in one's writing system, such as letters and digits, we call that symbolic naming. And then non-symbolic items that are not used in one's writing system, such as objects and colors, we call that non-symbolic rapid naming. So in summary, dyslexia results from a subtle problem in language, not in vision, even though if you ask most people, your neighbors, they'll think it's a problem with reversals. Just a quick thing about reversals. Why is it such a common belief? If you go in a second grade classroom and you watch a child who's struggling to read, they will make reversal errors, was for saw, B's for D's. And the children in the classroom who don't have reading problems won't be doing that. But it turns out that reversal errors are universal in kindergarten, and they're very common in first grade as well. If you're going to confuse a B with some other letter, it will be something that looks like it, like a P or a D. And in terms of was versus saw, we read English from left to right, but that's something you just have to learn to do. Other languages don't do that at all. So it turns out that when you see a child in second grade making reversal errors, it's because they're reading really at a first grade level or a kindergarten level. So they're making the kinds of errors that are very common in those classrooms. The language system that's involved is the phonological system, and we're going to be talking a little bit more about that and how to assess it. And there are three kinds of phonological processing that are important for reading: phonological awareness, phonological memory, and rapid naming. Now we're going to move to assessing phonological processing with the CTOP2. The comprehensive test of phonological processing, which is abbreviated as the CTOP2 for the second edition, measures phonological processing. Unlike other tests that have to cover the cognitive and achievement waterfront, it has 12 subtests that came from tasks we were using in actually a decade of research that measure these three kinds of phonological processing, with multiple subtests forming phonological composite scores. So the actual subtests you see on the CTOP are ones that we developed through our research for over a decade, with one exception that I'll blame Joe Torgerson on. I'm actually doing this from what's called the Torgerson Library at Florida State University. Joe Torgerson has retired now, but very famous learning disabilities researcher, studied memory problems in children with learning disabilities. And when it came to creating the CTOP, because he was the memory researcher, he was the one who put together the memory for digits or digit span task we have on the CTOP. So we released the original CTOP, and about a month later, we get an email from someone saying, look, I just gave the CTOP, I really like it, but I just, it has memory, it has digit memory on it. And it's the same task I gave, a couple days ago when I gave an IQ test. And so I gave this to Joe, and he wrote back, well, digit span tasks are pretty common. They're on an IQ test and other sorts of things. It's not going to be a problem, because the digits will be different. And the person wrote back, no, the digits were the same. What had happened was Joe had, long ago in his research, made a copy of a digit span task from some IQ tests and used that in his research, forgot where he got it from. And so we had to quick change the digits on the CTOP. But all the rest of them came from years of working on our own research. So what comes in the CTOP? You get an examiner's manual, provides valuable information about phonological processing and its relation to reading dyslexia. Specific instructions are provided for administering and scoring the subtest. The tables here are also found for obtaining percentile, standard scores, and composite scores. There's a picture book. It's needed for giving the rapid naming subtest and for the sound matching subtest that's given for children ages 4 through 6. There are CDs for administering the phonological memory test, subtests, and all subtests that involve non-words so that the examiner doesn't have to be able to pronounce non-words. And there are record forms. We'll review a completed record form later. The record forms also have a page for each subtest, and you use that when you're administering the subtest. It says, it sort of tells you what you're supposed to say and what the items are, and place a record what the child does. And there are two record forms. One, this is the one for ages 4 to 6. The other one was 7 to age 24. If you happen to have given the CTOP and you wonder what are the differences between the CTOP and the CTOP 2, there are new norms. The floor was lowered with the addition of some basic items. So now the test actually goes down to age 4.0. Phoneme isolation was added as a new phonological awareness subtest. And we added rapid naming of digits and objects to the 4 to 6-year-old version, because now many 4 to 6-year-olds can name digits and objects just fine, which gives us measures of symbolic and non-symbolic naming for the 4 to 6-year-old version. So the three kinds of reading-related phonological processing that we've talked about, those are the same three kinds of phonological processing that are assessed by the CTOP2. There are four primary uses of the CTOP2. It can be used to identify individuals who are deficient in phonological processing, its most common use. It can identify some individual strengths and weaknesses. It can evaluate progress in response to remediation of phonological awareness deficits, and it's also used very frequently as a measure in research. So who can administer the CTOP2? You should have formal training and assessment. It's highly desirable that you had supervised practice in test administration. College courses and workshops are the most common way that people acquire these skills. Most people who give the CTOP have backgrounds in school psychology, speech pathology, special education, or perhaps they might be reading specialists. In terms of some administration guidelines, it's appropriate for individuals age 4.0 to 24.11 in age who can understand the directions. And if you gave the entire core battery, it takes about 30 minutes to administer. Subtests should be administered in the order they appear on the record form. If you administer only selected subtests, do them in the order they appear. And it's okay to give selected subtests rather than the entire CTOP2. For example, if you suspect a phonological awareness problem based on a subtest, maybe like in the Woodcock-Johnson, you might just give the 3 subtests that form the phonological awareness composite score to get a more in-depth look at phonological awareness. There are 2 versions of the CTOP2, one for children aged 4 to 6, one for individuals aged 7 through 24. Ceilings are provided. If you go beyond the ceiling and accidentally administer additional items, that's fine, but just don't give any credit for any items above the ceiling, even if they're answered correctly. Follow good testing practices and see the manual for good testing practices specific to the CTOP2. In terms of the materials that you need that examiner record booklet that we talked about before, the picture booklet that I've shown, a CD and a device for playing the CD, a stopwatch, and a sharpened pencil with an eraser. Turns out that examiners commonly now are uploading this CD on iTunes or some other comparable service, and then using their phone or their iPad to deliver the audio content. So you're able to do that as well. So there are, I mentioned there are subtests and they form composites. Here are the CTOP2 subtests and composites for the 4 to 6-year-old version. So we have phonological awareness, which is made up of elision, blending words and sound matching. Phonological memory is made up of memory for digits and non-word repetition. Rapid symbolic naming includes rapid digit naming and rapid letter naming. And rapid non-symbolic naming is rapid color naming and rapid object naming. And there's a supplemental subtest blending non-words on the 4 to 6-year-old version. So let's look at a couple of these subtests now. Elision. You're asked to say a word after dropping out part of it. For example, say cowboy without saying cow, or say grain without saying, and the answer is gray. If you were only going to give one subtest from the CTOP, elision is often the best one to do. It's the one that's most predictive of reading problems. To give elision, nothing is needed beyond the record form. Make sure you pay attention to when directions and feedback are given, because that changes throughout the subtest. And note that the progression of item types that you'll see follows that developmental progression that we talked about earlier. Moving to blending words. Spoken words are presented in parts that must be blended together to form a word. For example, you will hear a word one part at a time. Listen carefully and put the sounds together to make a whole word. Ooh, s. And the child has to say moose. For blending words, you need the core CD and a device to play tracks 1 through 33. If a child asks for items to be repeated, 1 repetition is permitted per item. For items 1 through 12, if the child says the sound separately, in other words, m, e, rather than me, try to say the sounds all together as a real word. Sound matching. Here the task is to identify a word that begins with the same sound as the target word. Later it changes to identify the word that ends with the same sound as the target word. For example, which word starts with the same sound as soap, ripe, toast, or sand? The correct answer is sand. To give sound matching, you need the picture book, and there are 2 parts, first sound and last sound. For all items, pause 1 second after saying the target before saying the 3 alternatives. Point to pictures as names are pronounced. The child may point to or say the answer. And items can be repeated once if the child appears to forget the names given to the pictures. For the CTOP 2 subtests for the 7 to 24-year-old version, phoneme isolation replaces sound matching. We only have rapid digit naming and rapid letter naming, but now there's a supplemental alternative phonological awareness composite made up of blending non-words and segmenting non-words. In terms of phoneme isolation, here the task is to say a part of a word that represents the first, second, third, or fourth sound. For example, what's the second sound in a word which? The second sound is the I, so that would be the correct answer. To give phoneme isolation, nothing is needed beyond the record form. Pay attention to when directions and feedback are given. There is an alternative phonological awareness composite score. It's for children and adults aged 7 through 24 only. It consists of blending non-words and segmenting non-words and can be used to verify a phonological awareness problem. And I'll say more about when to use that in a little bit. For blending non-words, you need the supplemental subtest CD, tracks 1 through 31. You may replay an item 1 time if the examinee asks you to or gives no response. And for items 1 through 12, give the prompt. Try to say all the sounds all together if the examinee repeats the sounds separately. For segmenting non-words, you need this supplemental subtest CD, tracks 32 through 64. Repeat an item if the examinee mispronounces a word or asks to hear it again. Prompt with, now say the non-word 1 sound at a time if the examinee forgets to. There's a phonological memory composite score for all children and adults. It's made up of memory for digits and non-word repetition. Memory for digits, the task is to listen to a string of digits, then repeat them back in the correct order. Here's an example of one. With memory for digits, you need to have the core CD and a device to play tracks 34 to 63. If a child asks for an item to be repeated, no repetition is permitted. For items 1 through 4, if a child makes an error, count the items incorrect but give the correct answer. You might notice that the digits come fast here relative to what you see on other tests for digit span here, and they do, which is why it's good to use the CD audio. The reason they come faster on the CTOP2 is to focus on the phonological storage system and lessen the influence of rehearsal strategies. So when you hear 1, 7, 8, 9, you're going to really rely on your phonological store to be able to remember those numbers. But if I slow it up, 1, 7, 8, 9, you have more time to do things like say, okay, 1789, well, that's an interesting time in early American history. So you can use rehearsal strategies. Harder to do when the digits come quickly. Non-word repetition. The task here is to listen to non-words and say them exactly as they are heard. For example, listen to this made-up word and then say it exactly as you hear it. Vusasov. For non-word repetition, you need the core CD and a device to play the tracks 64 to 96. If the child asks for an item to be repeated, no repetition is permitted. Pay attention to feedback given on items 1 through 9. The non-words on the CTOP2 were created to emphasize phonological processing by making them not resemble real words. In the past, people used to come up with non-words by simply taking a regular word and swapping out one sound, like cat would become zat, for example. But what happens is that your lexical knowledge of real words is used a lot when you're working with non-words that resemble real words. So to really focus on the phonological processing system, it's best to use non-words that are non-word-like. And that's how we selected them on the CTOP2. So for the rapid naming composite scores, for children aged 4 to 6, there are 2 rapid naming composite scores, rapid symbolic naming, rapid non-symbolic naming. For children and adults aged 7 through 24, the only rapid naming composite score is the rapid symbolic naming. Rapid letter naming requires letters, reading letters presented in rows as quickly and accurately as one can. Rapid digit naming is similar, except that digits rather than letters are named. You need a stopwatch and a picture booklet to administer these subtests. You want to record the number of seconds to name all the numbers on the form. If the examinee hesitates for 2 seconds, mark it as incorrect and point to the next item and say, go on. If a line is skipped, redirect the examinee to the skipped line. For rapid non-symbolic naming, we have rapid color naming, requires naming colors as quickly and accurately as you can. Rapid object naming is the same, but common objects are named instead of colors. You need a stopwatch and a picture booklet as before, and you do the same 2 prompts. So that ends our first part. And for the second part, we'll move on and talk about scoring and interpretation of the comprehensive test of phonological processing. Okay, so for this part, we're going to begin by talking about scoring and interpretation of the CTOP2. Let's begin talking about types of scores. You have raw scores. They're scores earned on the subtest. Age equivalence identifies the age at which performance would be average. Grade equivalence identifies the grade at which performance would be average. People always want age and grade equivalence, so that's why they're still included in test manuals, but they're really not recommended for common use because of misinterpretations. For example, a 3rd grade student who gets a grade equivalent of 1.0 does not mean that the older student is the same in phonological awareness as the student who's at the beginning 1st grade level. The older student got a score that's the average score for beginning 1st grade, but that's all it means. Percentile ranks indicate the percentage of the normative distribution that's scored at or below the examinee's score. Subtest scaled scores are a standard score with a mean of 10 and a standard deviation of 3. Composite scores are standard scores with a mean of 100 and a standard deviation of 15. The developmental score is an equal interval score useful for examining absolute changes in performance over time. What this means is that the difference between, say, a score of 50 and 100 is exactly the same as the difference between a score of 100 and 150. This makes the developmental score useful for monitoring long-term progress in response to intervention. Some general recommendations. The composite scores are preferred over the subtest scores because they're more reliable. The composite scores are the most useful scores on the CTOP2. For subtests, standard scores are used to compare a score to the normative sample. Developmental scores are used to measure change in absolute performance. Composite scores are available for each of the three kinds of reading-related phonological processes. So there's a composite for phonological awareness and alternate phonological awareness for the 7 to 24-year-old age form, phonological memory, and rapid naming. And they're simply combinations of those individual subtests, and that's why they're more reliable. In terms of interpreting composite scores, average is 90 to 110. Most people score in the average range. Above that, you're going to be either above average, superior, or very superior. Below that, you'll be below average, poor, or very poor. Scoring in the below average, poor, or very poor range is reason for concern. Note that tests sometimes vary in how they label scores. For the CTOP2, a composite score of 89 marks the beginning of the below average range. Subtest scale scores are standard scores that are identical for each subtest, making it possible to compare performance across different subtests. The average subtest scaled score is 10. And in terms of interpreting subtests, scaled scores, 8 to 12 is average. Above that is going to be above average, superior, or very superior. And below that, 6 or 7 would be below average, 4 or 5 would be poor, and 1 or 3 would be very poor. Here's an example of a completed front record form for Joshua Jones, who's in 2nd grade. And what we're going to do is we're going to work through this front page in each section and talk a little bit about the performance of Joshua Jones. So identifying information goes in the upper right-hand portion of the examiner form. So you want the child's name, their gender, grade, typically school, teacher's name, and often your name. And then here's where you also calculate the child's age for normative purposes. So here's the score reporting section, and we'll talk about each of these kinds of scores. But you see in the very left, raw scores, then you see age equivalents, grade equivalents, percentile ranks, scaled scores, standard error of measurements, and then descriptive terms about what those mean. If you go down to section 3 in the composite performance, what you see are scaled scores entered for each of the subtests. You sum them to get sums of scaled scores, and then you look in the manual to get percentile ranks and standard scores for composites. And then descriptive terms are there as well. And descriptive terms are at the bottom of the record form. So raw scores are simply how many items were correct for each subtest. Not very meaningful for comparing subtests because they have different numbers of items. Age and grade equivalents, these are the ones we mentioned before, and they're easily misinterpreted. It's probably best not to use them. Scaled scores are the best scores to compare performance on the different subtests. However, it's better to use composite scores to see whether performance in phonological awareness, phonological memory, and rapid naming is the same or different, and we'll show you how to do that in a minute. Percentile ranks show that Joshua's scores are only better than or equal to the bottom 8 to 21% of his peers, which shows he's performing poorly on these measures. The composite scores and their descriptive terms follow. Joshua is below average or poor in every area of phonological processing, according to the composite scores. And the person who gave the CTOP 2 can look at tables to see whether any differences in composite scores between phonological awareness, phonological memory, and rapid naming are different, either statistically or clinically. So you can ask, are the two scores different statistically? In other words, is it unlikely that you get a difference that large due to chance? And you can ask, are the two composite scores different clinically? In other words, is the difference big enough to be important clinically? Beginning with statistically significant discrepancies, there's a table in the CTOP 2 manual, and you enter the column for which comparison you're doing between composite score differences. And at the very left, you get a level of confidence that that corresponds to the difference you found. So for example, if you're finding a difference, and if you're using the leftmost column and you see a difference of 9, you have an 80% confidence that that difference that large is statistically significant. More important, are the differences large enough to be clinically significant? And so here, there's a table for the 4 to 6 year old form. And there's also a table for the 7 to 24 year old form. And so you use these basically to tell, are there clinically significant differences in performance across the 3 kinds of phonological processing? In Joshua's case, he was low in each of the 3 areas of phonological processing, and there were no statistically significant or clinically significant differences in his composite scores. Let's move on to some frequently asked questions. First one is, when should I give the supplemental subtest? Well, it's good to give the supplemental subtest if you want to confirm the presence of a phonological processing deficit. It's always good practice to confirm hypotheses about an individual's phonological processing abilities by giving another subtest. Phonological processing is different from semantic knowledge represented by vocabulary scores, but it turns out that it's also easier to do phonological awareness tasks on words you're familiar with. So if you have an examinee who has a really well-developed vocabulary score, they'll have an advantage relative to the normative sample, even on phonological awareness tasks. That might mask an existing deficit in phonological processing. The supplemental subtests use non-words rather than real words, so a well-developed vocabulary is less of an advantage than it would be otherwise. So that's a real good reason to use the supplemental subtests. Can I diagnose dyslexia from the CTOP 2 alone? No single assessment can do this. As I mentioned before, the CTOP 2 is used to assess phonological processing. A deficit in phonological processing is a hallmark of dyslexia, but it's not sufficient by itself to diagnose dyslexia. What are some other things you ought to be looking at? Other things to be looking at are, first make sure that there's unexpectedly poor reading. It also makes sense to see, is there a family history of reading problems? I would look for evidence of poor response to effective instruction, and also pay attention to exclusionary criteria. Could there be a visual acuity problem that was missed, or maybe the child had limited opportunity to learn to read because of extensive absences because of maybe some major illness. Is a deficit in any of the 3 composites, phonological awareness, phonological memory, or rapid naming, a potential cause of dyslexia? Yes, each of the 3 kinds of phonological processing is related to and important for reading. If you're weak in one of these, it can impair your ability to learn to read. Can an individual have dyslexia and not score poorly on the CTOP 2? Yes, it is possible, especially if a lot of intervention on phonological processing has been given. This is going to be more common for phonological awareness, which does respond to intervention more than does phonological memory or rapid naming. And it's more common for an individual subtest than for a composite score. So in terms of a few reasons why someone with dyslexia might not show a phonological processing deficit, one, it's just a single indicator of dyslexia, and any single indicator won't be present in all cases simply because of measurement error. But that's why you're more likely to see a student with dyslexia perform well on maybe a single subtest. It's less likely to be the case they're going to perform well on the composites. Also, as I mentioned before, if you have a high vocabulary, you might score better on word-based phonological processing tasks because it's easier to do phonological processing on the items when you know the target word, which may mask an underlying problem. And that's, again, the reason that the non-word subtests are there as well. What's the double deficit hypothesis? It refers to being below average in both phonological awareness and rapid naming composite scores. There's some debate in the literature about whether this is a separate condition or just an indication of very low phonological processing. If an individual scores in the average range on the CTOP 2, but well above average in IQ or language measures, would this be an indication of a phonological processing problem? Yes, because phonological processing is impaired relative to performance and in other areas. This is a very important question because dyslexia students with very good language skills in areas other than phonological processing commonly do not meet criteria for having a specific learning disability in reading, and then they may not receive any help. However, they really do have a reading problem. They need accommodations to show what they know on tests, and they benefit from assistive technology such as text-to-speech. There's a person who works in the psychology department, and she has a brother with pretty severe dyslexia, but he's a functioning emergency room physician. He got accommodated testing when he went through medical school and when he went on the MCAT as well. And he uses assistive technology well in performing his job. Can poor performance on the CTOP 2 be due to inattention and not poor phonological processing? Probably not. Problems in attention and in phonological processing commonly co-occur, and both are predictors of dyslexia, but inattention does not explain poor performance on the CTOP 2 for most individuals. This is especially true for the phonological awareness composite. For phonological memory, those subtests do require a little bit more immediate attention, and for rapid naming, you require a little more sustained attention. So they can be affected a little more because of inattention, but a low phonological awareness composite score is much less likely to be due to problems in attention, especially because the CTOP 2 is individually administered, and it's individually administered in a quiet location. So you have the child's attention. What if there's a large range between subtest scores within a given composite score? Would that indicate the need for further assessment? It would suggest the need for further assessment. Perhaps the student did not understand one of the subtests. Can a child have a language disorder such as specific language impairment and dyslexia? If so, what would that look like? That's certainly possible. What you would expect to see is an impairment in phonological processing and in reading that is greater than the magnitude of the other language impairment that you see with the specific language impairment. Can the CTOP 2 be used to measure response to intervention? The developmental scores provide an equal interval scale that's useful for measuring longer-term response to intervention. The reason I say longer term is you probably shouldn't give the CTOP 2 much more frequently than annually to avoid practice effects. Does not using the audio CD invalidate administration of the CTOP 2? The audio CD should be used for several reasons. It provides a standardized assessment. It was used for the normative sample, and we're comparing an individual scores to those of the normative sample. And verbally presenting the items gives examinees who watch an examiner's mouth clues that were not available to individuals who took the test for the normative sample. Which composites should improve with intervention? Intervention is most successful for deficits in phonological awareness. It's been much harder to show for phonological memory or rapid naming. These are some frequently asked questions. If you have a question you'd like answered, don't hesitate to email me. That's my email address. I typically get 1 or 2 a day from someone who's been given the CTOP to someone and they had a question come up in terms of administration or interpretation. The 2 references I mentioned before in terms of the phonological processing paper is there along with the CTOP manual. And this will end our webinar, and I want to give a special thanks to our sponsors. Thank you very much. I hope you found this useful.